we thank you for coming to show your concern and your passion for the issue before us, Adult Day Health Services. And I understand you need to be thanked as well, because at least some of you were able to go to the hearing in front of the Rate Setting Commission to have your voices heard too. So you are in the right places to have your voices heard. Now, I want to apologize to you at the same time, because you should not need to be here to get the services that you are asking for. Co-chair Senator Jalen, from whom you'll hear in a minute, and myself, we are the chairs of the Elder Affairs Committee. And one of our highest priorities is to make sure that seniors and those with disabilities are able to stay in their homes and stay with their families as long as they are able and as long as they want to. And the Adult Day Health Program is one of the ways in which we can accomplish that. So that's why I actually came to know about this program on a more personal basis, because a very good friend of mine and neighbor needed to have Adult Day Health Services when her husband worked very hard to keep her at home. And they were able to work things out. And that was a number of years ago. And every year, I was already in the legislature because I've been here a while. And every year he would come when it came to budget time and say, now you're going to make sure you're going to fund these Adult Day Health Services projects, aren't you? So I came to know on a very personal basis how important these services are. So we will be working very hard to assure that we keep the services. You know that there are two different proposals that have been made that would cut the services. One of the proposals has to do with rates, changing the rates. And there was a hearing about 3 or 4 weeks ago about changing the rates for Adult Day Health. Now that's a backdoor way of saying we're going to cut money from the budget. It's not quite an honest way of saying we're going to cut money. But the good news from that is that at least for the moment, that has been pushed aside, taken off the table. So we hope it will continue to be taken off the table. The second proposal is more serious and would cut services way down. And I can only say that I am certainly advocating in the House budget, and I'm sure the Senator will tell you will be advocating in the Senate budget, that those cuts not be made. So we are all going to be working hard, and I know, again, I want to say that it's easy to come before a group and tell them everything they want to hear. And we're not here because that's what we just want to do to make you all feel good. It's because it is really the policy of our Elder Affairs Committee and of the state under law that we do what we should do by keeping these programs going, that we do everything we can to make community first be a reality. Thank you very much.